Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series, brought to you in part by a grant from the Iowa Oncology Society. And our topic tonight is social work. And we have a social worker with us.
Yes.
Hannah Moldovan is our guest. Welcome, Hannah.
Hi, thank you.
And Hannah is a colleague of mine. So Hannah is the social worker at the Mercy One Richard Deming Cancer Center.
Yep.
Welcome, Hannah.
Thank you. It's good to be here.
So let's learn a little bit about you first before we learn about social work in general. So where did you grow up?
Yeah, so I grew up in Sac City, Iowa, so Iowa native.
Okay. How big was your high school class?
My graduating class, I think, was 68 people.
Okay.
So
and what was your claim to fame in high school?
My claim to fame? You know what? I kind of just was a normal high school student. I didn't really stick out, but I was in band and I was in dance.
Okay. What instrument did you play in band?
I played clarinet.
Okay. So were you in the marching band?
Yep, we were in everything.
Pep band and the jazz band?
I was in jazz band in middle school, but not in high school.
Okay, and then dancing, was it like the pep dancing at a basketball game?
Yeah. Like the school dance team, we did like state every year, and then we did some stuff at like basketball games and football games and stuff. So
great. And then you went to Iowa State undergrad.
Yep.
And what was your first declared major when you went to college?
Oh, I think my first declared major there was Family and Consumer Science Education.
Okay. So that'd be like in my day, we might call a home ec teacher.
Yeah.
Okay. So you thought that maybe that's what you wanted to be.
Yeah.
And then what dissuaded you from that profession?
Yeah. So there weren't a lot of options. So I didn't think that I wanted to be a home ec teacher. There were some other options of things that you could work in, like an Iowa State Extension office. So that's what I was kind of thinking about. But those options were very limited. So I decided to change my major to child, adult, and family services, which was a bigger, broader kind of area. So
right. And when you were in undergrad at Iowa State, did you get opportunity to do some real world experiences in child and adult services?
Yeah. I when I was in that major, so like my senior year, I actually got to intern at Hamilton's Funeral Home for their Academy of Grief and Loss, which was a great opportunity. I learned a lot about grief and loss and, working with children and adults and in the community. So it was great. Yeah.
Great. And so you decided that you wanted to make a career out of this world of social work.
Yeah. Mm-hmm.
And so your next step in your education path was to University of Wisconsin in Madison.
Yep. That's where I got my master's. I went to University of Wisconsin in Madison. I was there for 2 years, and I got my master's in social work.
What is the curriculum for a 2-year master's in social work?
Yeah. So the first year is a lot of just education about theories. And where I went, it's a general education. So the first year is very general. You learn a lot about every aspect of social work. So you have the therapy aspect, you have the macro aspect, and then the client-facing kind of one-to-one. So you just learn a lot about kind of the world. And that's the first year. And then the second year, you kind of pick a focus. And I chose health as my focus. And then you kind of just dive deeper into that. So what does a health-focused social worker do? Learning those types of things.
And with that focus, were you assigned to a hospital or to a medical center to get your real world experience?
Yeah, so I worked, my internship that year was at the University of Wisconsin, their clinics. So they have various clinics in the surrounding areas and in their metro. And so I was at a family medicine clinic. I was actually in 3 different clinics. I was at a family medicine clinic. I was at 2 family medicine clinics, and then I was at oh my goodness, it's gonna escape my mind now. I was at 3 different
3
clinics.
different clinics.
So
And as a student,
yeah.
what were you doing? Did they give you, were you shadowing a social worker?
Yeah. So I had 2 social workers actually who I was shadowing. And so for the first portion, I'm just shadowing and seeing like what they do on a day-to-day basis. And then as the semesters progressed, kind of just working alongside them as a colleague. So I was doing field work. Yeah,
Okay.
a lot.
So tell us a bit of some of the tasks that a social worker does in a medical setting.
Mhm. Yeah, that's a very good question. A medical social worker does a lot of things, a broad range of things. What I did at University of Wisconsin a lot was advanced directives. So that state is kind of different. They're not a next of kin state, so advanced directives are very important in that state. So
And
I
for those
learned,
who might not know that term, what does that
yeah,
mean, advanced directives?
yeah. So an advanced directive, what I mean when I talk about an advanced directive is a healthcare power of attorney. And that is a document where an individual names what we call an agent who would make decisions for them if they were incapacitated in a hospital setting, or you can make it in not a hospital setting as well. But it's very important in the medical field because if you come into the emergency room and you're unconscious, someone has to make your medical decisions for you. So I helped a lot with those documents in Wisconsin, and that we were very thorough with them and had very long conversations about what do you want for your care. So I did a lot of that.
So that conversation isn't just about who's going to make the decisions for you.
Mhm.
It's also articulating what you would like the
Mhm.
decisions to be.
Yes. Like, do I want to be intubated? Do I want life-saving measures? Do I want CPR? Those really hard, tough
Mhm.
decisions and conversations to have with people.
And you're usually not having those conversations with 20-year-old healthy
No.
college students who come in for their football
No.
physical.
No, yeah. A lot with either older individuals or people with serious or terminal conditions. Yeah.
Yeah.
So tough conversations to have with families, but extremely meaningful and very important to
Okay.
do.
So that's one broad type of work as a medical social
Mhm.
worker. What are some other broad categories of work that a medical social worker does?
Yeah. If you work inpatient or something like that in a hospital, you'll do a lot of discharge planning. So if someone is in a hospital, they need to have a plan for when they go home, and that usually includes a lot of community resources, whether that's home health care or Meals on Wheels or getting their appointments set up after being inpatient. So a lot of medical social workers do just discharge planning.
And a lot of times discharge planning is, number one question, where are they going to be discharged
Yes.
to? Are they able to be discharged home?
Yep.
And if not, then it's like, okay, you don't need to be in the hospital, but you're not ready to be at home.
Yeah.
So that's a big undertaking for social workers.
Yeah.
I know that working with our social workers in the hospital, figuring out where the patient's going to go. Does that facility have an empty bed? Does the patient meet the qualifications?
Yep.
And then will insurance agree to pay for it?
Yes, there's a lot of moving parts, and I think from the outside it seems like a very simple task, but when you look on the inside, it is all those moving parts of they all have to line up for an individual to either go to a facility or even go home with care. Yeah, it's a lot of moving parts. So,
Yeah, even as you said, discharging a patient to home, but let's say now they need home oxygen.
Yep.
Well, you can't discharge them to home needing oxygen if you don't have the home oxygen
Correct.
ready to go.
And how do we get that ready in 24 hours or less?
And have it
Um,
there when the patient
yeah.
arrives, or they
Mhm.
need a walker, or
Mhm.
they need a hospital bed, or they need
Yeah. Any various equipment, any
Mhm.
home medical equipment. Yeah. Yeah.
So, discharge planning, another
Mhm.
broad category of work that medical social workers do.
Mhm.
What would be other broad categories?
I would say we did a lot of coordination of care, a lot of communicating between nurses and doctors, and then just other facilities. Like I have a vivid memory of helping somebody set up a colonoscopy. So again, all those moving parts, how are they going to get to that appointment?
Mhm.
If they don't have a ride, do they have a benefit through Medicaid? Do they have a paid ride for that visit? What did they have to do before that visit? How are they going to get home? Who's going to
Mhm.
stay with them? So,
Right. So the doctor ordering it just clicks a box colonoscopy.
yeah.
But in the real world, it's
Hmm.
okay. How did they get the prep
Yep.
med stuff that they have to drink to clean out? How are they going to get from their home to the place where the colonoscopy is?
Yep.
Are they going to get back home again?
Yep.
Do they need other support?
So I'm with them. Yeah. Yeah. So coordinating all those moving pieces, much like a discharge plan. So,
Mhm.
yeah.
Um, so, talk a little bit about what we refer to now as social determinants of health,
Yeah.
and how that plays into how a medical social worker integrates within, let's say, an outpatient clinic.
Yeah. So social determinants of health are all the outside factors that impact an individual's health or their health care. So, and I talk about everything. So, community, we can talk about food, housing, transportation, drug and alcohol use, um, who their friends are, who their family are, and their social connections. So, social determinants of health says that all those things impact a person's health and how they get health care. So, um, in a clinic, we really focus on all those different things and trying to close those barriers to care in those areas to make patients have better outcomes with their healthcare treatment, whatever that is. If it's getting into a primary care clinic, if it's getting into a specialty clinic, if they're getting some type of special care. So, and what we do as social workers encompasses that every single day.
Mhm.
Yeah.
And so the old school thing as well, a doctor just sits in the office waiting for the patient to show up. You write the prescription, and but if the patient can't get to the office,
Yeah.
it's like, well, it's another no-show. And
Yep.
you don't realize that, well, it's not necessarily a no-show
Mhm.
because the patient is not wanting to be there, but
Mhm.
they may not have a ride. They
Exactly.
may not, and then writing a prescription, if they don't have coverage to get the prescription filled, it
Mhm.
doesn't do any good to make a diagnosis and write a prescription if they can't actually get the prescription.
Yeah.
So the
Yeah.
whole aspect of the patient's life comes into play.
Yeah. Mhm.
And that reminds me of just another broad category that we often think of social workers as being the experts for what resources are out there in the community. What
Mhm.
are the city programs, the county programs, the state programs, the federal programs, and what are the rules, and that does this person qualify
Yeah.
for some of those benefits?
Yeah.
Because depending on income and where they live and other factors, they may be eligible for transportation
Mhm.
or
Yeah.
even food
Yeah.
or housing.
Mhm. Yeah. And that can be a big undertaking as well because those community resources are ever changing. There's federal programs which change and the qualifications change quite often, and then you have like your city programs. And a lot of times they're very specific programs for very specific individuals. So it's kind of just about knowing what's out there, and it takes a while to kind of learn that and get a grip on it. But knowing those is very important
Mhm.
because I refer patients a lot to community resources specifically for transportation and food insecurity and housing. And they're very important things that people need to have a successful life. And if they don't have those items, then those are kind of more priority than other,
Yeah. And then there's hundreds of not-for-profit organizations within a city that might be very specifically, provides hotel room for cancer patients receiving radiation more than 50 miles away from where they live. Or someone who needs transportation and they're from the Rwandan community. Greater.
Yes.
So how do you possibly keep track of all of the different organizations that are out there that have various forms of support services for various populations?
Yeah, that's a great question. So I have my own kind of what I call a resource guide. So I kind of just compiled from what I knew and made a bunch of documents of just listing, this resource, how you get a hold of them, where you can find their information. And it's something that's actually a working project for me right now. If I find a new thing, I, kind of add to it. And so, and it needs to be updated quite frequently as well. So it's always a work in progress.
So do you have this, is this an electronic, like an Excel spreadsheet sort of thing?
Yep, it's an electronic version.
So I remember way back I was probably an intern. I had a gray notebook. I called it my peripheral brain. And as anything that I might need to know how to get a hold of at any time was in this gray notebook that went with me as my peripheral brain. But now we have some more elegant ways of trying to keep track of things.
Yeah, you can use links. You can put links in the document and it'll take you straight to the website. So
yes, and you're not talking about a wildcat link.
Yes, no.
Okay. No, I know what you're talking about. Yeah, but trying to just and then keeping those updated.
Yeah,
because there's, but with modern technology, keeping things updated is a little bit easier.
For sure. Yeah. And even just knowing the name of the organization, that's honestly the most important part. As long as you know the name, you can either look it up or have a phone number.
It's probably been a long time since you actually used the yellow pages.
I don't know if I ever used the yellow pages.
But it is, it is amazing what just having a good browser, and you can find a lot.
A lot, yeah.
So let's talk a bit more now specifically. Was there any particular, any main category of social work in the medical setting that we left out in talking about the broad?
I don't think so.
It's out now specifically in a cancer center.
Yeah.
I think I just thought of one general area that we didn't go into, and that would be individual psychotherapy counseling.
Yes.
So social workers, depending on their education and type of education and experience, sometimes serve as a therapist. So at what point can a social worker, we can all be a good friend and confidant to people and help them through difficult times. But in terms of actually providing mental health counseling and being reimbursed for it, what does it take for a social worker to have those credentials that they can actually serve as a mental health counselor?
Yeah, so in the state of Iowa, and it varies into every state, but in the state of Iowa, there are multiple avenues or routes you can get to be a mental health therapist. You can be a licensed mental health counselor, substance use disorder counselor. But for social work, you have your master's, so you have to get your master's, and then you have to, for 2 years, it's a period of 2 years is the minimum, and then you have to get about 3,000 hours of supervision from an individual who has their clinical license to do mental health therapy in the state of Iowa. So here that's an LISW, Licensed Independent Social Worker. So You do that for 2 years, you get your experience, you have to have a certain amount of client-facing hours, so actually doing, the therapy, and then you take an exam, and you pay for a license, and then you're good to go.
Gotcha. And so being a social worker actually being credentialed to do mental health counseling
Mhm.
does require at least an extra 2 years.
Correct.
And this is done while you are working at
Correct.
a real job. So you're
Yes.
doing your job and trying to get hours in where
Correct.
you're providing counseling under supervision.
Yeah, and it's 2 years full-time, so you can be employed at a mental health, like, facility and be doing it under somebody, but that's 2 years full-time.
Mhm.
Yep.
Yeah. So now let's talk about the role of the social worker with oncology
Mhm.
patients. Did you work in an oncology setting prior to coming to Mercy One?
I did not. I did work with a few people who had cancer, but I didn't specifically work in an oncology
Mhm.
center.
What would you say are some of the special situations that cancer patients have, or what are the main things that you have worked on as a social worker within the cancer center?
Yeah, so I do a lot of financial assistance and questions about insurance. I'm in no means like an expert on those things. I try my hardest, but those questions come up quite a bit, with health coverage and what is covered, like what of my treatment is covered and that type of thing. That, and then I would also say mental health has been coming up a lot. A cancer diagnosis is very, very taxing mentally. And so I get a lot of people who want a mental health referral. Um, what else do I do? I would say that those are the 3 main ones. I do a
Mhm.
lot of financial assistance.
Yeah, and part of that financial assistance, I can think of times where I get you involved. Actually, one today referring to you as someone who's trying to decide whether to stay with their employer's disability, long-term
Mhm.
disability. Would they qualify for Social Security disability,
Yep.
SSDI? And at what point, if they are on Social Security disability, do they have Medicare as their
Yep.
insurance? So that's an area of expertise that we rely on
Yeah.
social workers
The
for.
whole world of government programs. Yep, that too. I help a lot with Medicare, Medicaid, SSDI. Those questions come up quite a bit as well. So.
How would you compare and contrast Iowa and Wisconsin
Yeah.
in terms of, let's say, supportive services? Now, I know you were in Madison,
Mhm.
and Madison is a quite liberal community,
Yep.
and I would bet that Madison, Wisconsin, probably the city of Madison, probably had some fairly good programs around food security and housing and maybe even mental health. But perhaps I'm wrong
Yeah.
about that.
Yeah, no, Madison, yes, very comprehensive with their resources. I worked with a lot more homeless individuals in that area. There's more homeless individuals there from my experience and my perspective, at least with who I worked with. But they have very comprehensive resources. I would honestly say that Des Moines has very comparable resources.
Okay.
I wouldn't say that we have less by a considerable margin. I think there are a lot of good services in the Des Moines metro. Now, if we want to talk about a rural area, rural areas have slim to none. So, but yeah, I would say Des Moines is very comparable with those
Mhm.
supportive services.
Okay. And have you started to work on your counseling
I
skills?
sure have. Yes, I have
So
started.
how does that work when you're getting, do you, the first few times you just sort of like sit in the corner of the room and observe, or at
Yeah.
what point do you become an active participant in mental health counseling?
Yeah. And that's a good question because it's tough, right? Not a lot of people want to let some stranger sit in on their therapy session. I mean, I wouldn't. So, but I did get some gracious people who let me sit in, and I got to observe them talking with their counselor, which was amazing. And it gives you great perspective into what a session is actually like. So, a lot of that, and then honestly, just jumping into the deep end and kind of doing it. As long as you have that education and those tools to use, just kind of jumping in with a client and sitting with them and listening to them, hearing their story, and just being present with them. So, yeah.
So much of the mental health work we do in cancer, from my perspective, is kind of this existential facing, say, a patient with stage 4 disease. The disease is treatable but not curable, and so you're dealing with this angst of knowing you have a disease process that's going to result in your death. You have anticipatory grief, sort of grieving things you're not going to experience.
Yep.
And worrying about your family and how you're going to get everything done, as opposed to perhaps a different type of mental health situation where you might be dealing with a young person who has schizophrenia or bipolar, where you might need a lot of medications in addition to counseling. So the type of counseling that we're mostly experiencing in cancer, not that someone who has more serious mental health issues might also have cancer. What happens when you're in the midst of your counseling and you think that this person probably needs some medication help? Because as a social work counselor, you're not going to be prescribing medications.
Yeah, that is out of my scope.
Yeah. So how do you collaborate then with the other mental health providers that do have the ability to write for medications?
Yeah, that's a really good question. So in that situation, I would either refer to someone who is able to prescribe those medications. The patient would obviously have to meet with them to talk with them about it. But a lot of times psychotherapy, like a psychotherapist would be able to prescribe that. Psychiatrist, even family med doctors can even prescribe those sometimes. So that's probably what I would do, have them talk to another provider.
And do you actually help facilitate that handoff?
I'm going to be honest, I've never done it
before.
I haven't done it yet. So
I just know that with a shortage of mental health providers, I mean, hopefully we don't get to the point, well, I'm sorry, I can't help you. You need someone, and here's a list of people and their phone number that we could do a hot handoff.
Yeah. I try to do that as best I can with any situation, trying to get the patient or the client from me directly to somebody else. So if that were to come up, that would be what I would ideally want to do, directly connect them with a provider. But in a perfect world, sometimes it's not always doable.
Yeah, unfortunately, without there being adequate supply, you end up with sometimes the emergency room being the only solution if you can't get in to see an appointment, see someone, a professional in a timely manner.
Yeah.
What would you say has been the most gratifying part of your work as a social worker in a cancer center?
Yeah, I love this question. I think just working with individuals and getting to actually know them, and knowing that, the work and the effort that I put in actually does make a difference. I mean, everything that everybody does makes a difference, but it's very rewarding to see or even hear from a patient like, thank you so much for taking the time to listen to me, or following up and doing what you say you're going to do. And it's really about just holding that time for patients. And I just want patients to be better off after they see me than before they see me. So
good. And then the flip side of the coin is, what is the most frustrating aspect of doing your work?
Yeah, I would say working within a system, and and that's many different systems, whether it be a hospital system or the federal system. They're not always perfect or built, to support the patient in the best way. And that's an easier fix said than done. but I would say that's frustrating. Sometimes you really want to get a patient assistance with something, and you just hit some red tape, right? With
You
government
fill out a
programs.
form and
Yeah.
then you wait.
Yes. Yep. And you wait
you
for a
don't
month.
know when you're going to find out.
Yeah. Yeah. And I do everything I can to try and get a connection, and I'm not on the HIPAA form, so just it can be red tape sometimes. Yeah.
Okay. Where do you see yourself 5 years from now?
Oh my gosh, 5 years from now. Still in social work. I'm really not sure. Like I really enjoy what I'm doing right now. So I really hope that I'm still working with cancer patients. I've kind of grown, a little bit of a soft spot for them. But definitely more, I want to dig a little bit more into the mental health side and see how I can help, especially cancer patients.
So you
with
see
their
yourself
mental-
as getting that credentialing to be able to
Yes.
be
Yep.
a certified counselor.
Yeah.
LISW.
Correct. Yep.
Okay. Good.
All those letters.
Okay. Well, let's open it up to questions here from the audience about the role of social work in cancer care. And if you're watching us live streaming right now, you can put your questions in the comments section.
We hear a lot about Medicaid cutbacks and problems with Medicaid. Do you find that there are fewer options available for people that need Medicaid type assistance, financial assistance particularly?
Yes, I would say that Medicaid, and the cost of living goes up every year. So Medicaid will adjust, their income limits, but not, adequately. So I really see that the income limit for Medicaid is very, very low, and a lot of people could benefit who make quote unquote too much money. So I definitely see that. And then I would also say just, what Medicaid covers, right? It's not the ideal health insurance for a lot of people. Private insurance can cover a lot more. It really depends. But, people on Medicaid don't, have the resources to buy and purchase private health insurance. So, yeah.
And as far as the work that you do, what about the overlap between someone in your role in a hospital, somebody that does some of these responsibilities in government, and then people that also do this type of work in faith-based organizations?
Yeah, that's a great question. So I work a lot, and I actually had a situation today where I should have communicated with a social worker inpatient before I reached out to the patient. I didn't realize they were inpatient. So those types of things, or like with the chaplains in the hospital, those are some really helpful individuals who sit with patients and talk with them, and it's good to kind of have a conversation with them before meeting with a patient to kind of get that overall care, get the whole story. My role overlaps a lot with nurse navigators. They help a lot with resources as well, but I just kind of see it as working as a team, right? So I just communicate with those people as best I can, and get those patients the care they need.
Yeah, one of the things that we're hoping to improve upon is getting a unified medical record so that everybody is documenting in the same record.
Yep.
So right now the situation is there's 5 different records where different people are documenting, and they don't talk to each other, and you don't know. So you're right, you don't want to be duplicating where you've got a social worker in the hospital working on it, and you're working on it because you don't know that the patient has just been admitted to the hospital. And so that is frustrating, but trying to coordinate care with all of the different people helping the patients, both in the medical setting and then in their depending where they're living, they may have social support. If they've got Medicaid, they may have social support. If they're going to a federally qualified health insurance for provider for medical care, they may have all sorts of services as well.
Yeah, so it's just about knowing about all those aspects of a patient. Are they in a facility? A lot of long-term care facilities have social workers, and they are definitely point people. So.
Other questions?
Uh,
Tim.
Yes, I have two questions for you. And first of all, I want to give you a compliment because I know that social workers have a lot of interactivity with their clients and there's lots of eye contact. And I noticed that you and Dr. Deming have tons of eye contact. So,
Is it too much?
I think it's wonderful what you're doing there. Okay.
Thank you.
So I have an easy question and a hard question. And
Okay.
the easier question is about how many clients do you see each day?
Mm-hmm.
And the second question is when you go from client to client, how you prepare yourself to make that change from client to client?
Yeah, very good questions. So I would say, and I do a mixture of seeing patients face to face and then calling on the phone. So I do a lot initial over the phone just to kind of see what needs are before I make that face to face. I would say anywhere from 15 to 20 a day. I mean, if you count how many people I'm talking to over the phone, how many phone calls I'm making, and then if I'm making like coordination of care, if I'm reaching out to, about an application. So it's not directly face to face, but that's about how many people I'm working with every single day. And also that varies during the year. And then how I kind of change my mindset. That's a really good question. I guess it's really just about kind of like reviewing the chart. Like I'll review the chart and see kind of like what's going on new with the patient or coordinate with a nurse or something like that. With mental health, it's a lot harder. I have to, kind of take a second for myself because that's a lot, when I have a 45-minute conversation with someone about, their struggles in life. I definitely have to take a second and kind of just take a break and kind of regroup. Take care of myself before I move on to the next patient because I want to be there 100% for each patient. So taking that self-care is important.
Good.
Yeah.
Hannah, at the Richard Deming Cancer Center, what's the biggest needs you find that you have to fill for the patients?
That's a good question. I would say largest need would be financial. And then I would say probably mental health right after that. I've been having a very large increase in mental health need lately. So definitely those two. Transportation also tends to be a big one as well.
Mm-hmm. And financial, I mean, if everything were all set financial, then that solves some of your food security and housing and transportation. So they're all tied together.
They're all tied together. Yep.
But if someone is lacking in adequate financial resources, then usually you end up with also food insecurity,
Multiple
housing
issues.
insecurity, transportation issues, and everything.
Yeah.
Very interested in the mental health issues. You've mentioned it a couple of times. The need is increasing. That's fairly clear. Why would you say that is? And is there any common theme? What's behind this?
Yeah, that's a very, very good question. I think for one, mental health is becoming a lot more understood and accepted. And so I think more people are reaching out to it as a resource. And then I would also say that there's just a lot of things going on in the world right now that are taxing everybody mentally. And then you add a cancer diagnosis up on top of that. And, it's just overwhelming. And I think that the population that we work with, a lot of older individuals, they might not have anybody to reach out to talk to. So, maybe their friends have passed or they don't have very close family members. So that I think that might be a reason as well. But I think there are a lot of factors out there that are making mental health kind of show up in a big way right now.
I would say one thing is we're very proactive about asking about issues related to social determinants of health and mental health. So just about any doctor you go to, you fill out these little surveys before you
Yep.
see the physician. And depending on how you answer the question, you might automatically get referred to a social worker to sort out, is this something of concern?
Yep.
Whether it's food insecurity, housing, transportation, feeling threatened in your home environment,
Yeah.
or
Yeah.
all of those are being proactively asked of patients, and with the idea that if you answer a question a certain way, then that gets a
Yeah.
referral
Mhm.
to start looking at those more deeply.
Yeah. Yeah. And that's a lot of the reason I spend a lot of time on the phone, because sometimes, people are just stressed because they have a cancer diagnosis, which is completely understandable. And that's how they answer the questions the first time around. And then they get some answers from doctors and they get a plan and they're good to go. And then, there's not really a need for me, and that's great. I love when there's not a need for me. That means that person's doing great. And so, and then there are other people who need me, which is awesome as well. I'm glad that I'm there to help those people.
Yeah. I'm kind of going to circle around what everybody's been asking, but as a cancer survivor, I can say that having a counselor during the treatment, going through the cancer, it was very helpful, even aftercare as a survivor. Because I am the only family member, and I'm always reminded of this from my family members, that survived cancer or beat it, where both sides of my family didn't. It's kind of like you're left with that survivor guilt, and you're
yes.
Please stop telling me that. I mean, for them, it's thinking this is great. For me, it's like, don't remind me of that. But you talk about working as a team. So do you work with another counselor when you're talking about a team and working with the doctors?
So that's a great question. So in the cancer center, the outpatient cancer center, I'm the only social worker. So when I talk about working as a team, I'm more talking about working with the nurses and the doctors and the schedulers, everybody who's a part of that team. But then I'm also, I actually have a contact at the other hospital in town she's my counterpart. So she has the exact same job that I do, basically. And I consult with her all the time about patients and, what's the best kind of way to work this situation, how do I help this patient. And then we also have a palliative care social worker inpatient who does counseling as well, and I go to her a lot with questions as well. So it's kind of those random people in the social work world who have that experience that I reach out to, just to make sure that I'm giving the best care that I can to the patients. So.
And as you come to a new community,
Yes.
learning all the resources.
Yes. They have all been so great to me, and I'm so grateful for them. They've helped me, and I would not be where I am right now without all of their support. So that's great. I love them.
A question about the role of a social worker with cancer or any medical setting. People are wanting things done. They want you to do things, but is there a line? I mean, is there a place where, no, I can only point you towards it. You have to do this yourself. And how do you determine where that line's at?
That's a great question as well. That's a tough line. And I think in the social work world, in school, we're taught take care of yourself and set boundaries and do all these things. And you graduate college and you're like, I'm going to set boundaries and I'm going to, do all these things to be proactive. And it's hard because you meet your patients and you want, you're like, I want to do anything I can to fix the situation. So it is a really hard, decision, but you also want to empower patients to, do things on their own. If they are capable of, contacting this resource, maybe they're just nervous. Hey, do you want me to call them with you? We can all be on the call together, or I can get you guys connected and then you guys can kind of go from there. So it is a line. I do only have so many hours in the day. But I try to kind of do it on a case by case basis, of how I feel the person needs help.
Sometimes a patient will come in with these disability forms, and typically the first part they're supposed to fill out the part, and then you get it to the doctor who fills out the part, but they often come in with it's just empty. And you can't submit it without their part being filled out.
Yeah.
And so there are times where you say, well, let's help you fill this part out. And then you have to sign this, and then I fill out this part. And you're right, but you don't have time to fill out every patient's forms for everything. But there are some patients that
they need it.
They really
need the help.
it. They just don't have the ability, to stay focused long enough to fill. And the forms can be very confusing, and the questions they ask are not clear. And if you don't fill in everything blank, correctly, then it doesn't get done. So it is very difficult. And so we definitely all spend time
helping
get those forms filled out.
Yeah, and usually it sorts itself out. Like the people who can do it on their own, they do it on their own. If they need help, I'm more than happy to help if you express that you do need help. So it usually sorts itself out.
A question from an online viewer. Dina is watching on Facebook. A question for Hannah. What has been the most meaningful lesson that you've learned dealing with cancer patients thus far?
That's a tough question. I don't know if it would be a most meaningful experience, but I guess one thing that I've noticed working with cancer patients is that, I'm only 24. It feels old for me, but it's not. But I don't have a lot of life experience, And so I meet with these individuals who've lived incredible lives, and I feel that I just learn a lot from our patients. And, I learned that life is very precious, and I go home every day knowing that life is precious. And I think that that's one thing that I've really taken away from this job. And, the patients I run into so many people who are just so positive, even in their situation. And so knowing that, to be grateful for my life and, all the positive things, and knowing you can get through tough times as well, I would say is one thing that I've really learned from all of our patients.
Great. Other questions? Well, Hannah, this has been great. I just want to personally thank you for all you've done for all of our patients.
Yeah.
We are so happy you've said yes to our cancer center, and I really enjoyed this conversation, and look forward to helping you achieve your goals.
Yeah.
And so thanks for being here this evening.
Thanks for having me. It was great.
And if anyone watching this knows of someone who would benefit by watching this program, it will be available on demand to watch anytime you would like, beginning tomorrow at the Above and Beyond Cancer YouTube channel, and also the Mercy One Cancer Center website. I hope you'll join us again next week. Thanks, everyone.